Good afternoon, everyone. I'm Curie, a nephrologist from Korea. The topic of my presentation today is ethical challenges in establishing transplant program in resource-contained areas. This presentation will be focused on Asian countries. I have nothing to disclose, but I'm working with these listed organizations related to transplantation. I think there are 5 key points in elucidating ethical challenges in organ transplantation in resource-contained countries. Those are forming ethical principles in organ transplantation, concept of self-sufficiency, ethical challenges in reaching self-sufficiency in resource-contained countries, and ethical problems as consequences. Ethical principles in organ transplantation are based on 4 main principles of beneficence, non-maleficence, autonomy, and justice, and had been summarized by WHO Guidelines, Declaration of Istanbul, Pontifical Academy of Science Statement, and many others. Self-sufficiency of Madrid 2010 is the essential condition for ethical organ transplantation. To achieve self-sufficiency, each nation is needed to establish operational and regulatory structures under the legislative framework coincide with ethical principles and the National Transplantation Authority. The Madrid Resolution also presented 3 categories of national responsibilities for self-sufficiency. Those are increasing organ availability, ensuring fairness, justice, and transparency, and preventing the need for organ transplantation. However, reaching self-sufficiency in low-middle-income countries can be a pie in the sky due to limited financial and the human resources and low social and cultural receptibility for organ donation. And this societal shortage bring out organ shortages. Among many ethical problems caused by the organ shortage, I would like to discuss with you today on issues related to organ trafficking, transplantation commercialism and financial neutrality, monetary compensation for deceased donor funeral, and gender disparity as a form of violation of autonomy. The most important ethical challenges in LMIC is organ trafficking. As you can see in this famous map of 2017, many Asian LMICs are listed in the country watch list of global organ trafficking. This situation has been originated from specific conditions in organ transplantation in Asia. Those specific conditions include high level of surgical and medical expertise that is not uniform across Asia, large recipient populations, less well-established programs of deceased donor, access to transplant is not uniform, and government and private support for transplantation lacking. Unfortunately, the possibility of global organ trafficking seems to persist, speculating from this recent map, still showing global health inequity in organ transplantation. And this data from GODT, among those 51 Asian countries, only 43% is performing both deceased and living donor kidney transplantation, 24% is performing LDKT only. 29% of Asian countries may not perform KT at all. Next, I'd like to discuss with you an ethical challenge related to the financial burden. In 2015, the Transplantation Society published an article titled Living and Deceased Organ Donation Should Be a Financially Neutral Act. To summarize the contents, organ donation should remain an act that is financially neutral for donors, neither imposing financial burdens nor enriching them monetarily. Ethical principles related to reimbursing financial burden in living organ donation stated in the WHO Guiding Principle Article 5 is the prohibition on sale of organs does not preclude reimbursing reasonable and verifiable expenses incurred by the donor. However, there exist questions of who will pay for the reimbursement in resource-containing countries. As you know, it takes a fair amount of money not only for organ donation but also for others such as pre-donation evaluation, post-donation care, or travel costs, etc. And those expenses are frequently paid by the recipient in many LMICs. In other words, if the country cannot provide universal coverage for organ donation, fees for donor management are usually paid by the recipients. If the country has no system for an indirect payment, donors and recipients will be exposed to the risk of transplantation commercialism and to economic inequity because recipients are less likely to proceed to transplant if they cannot afford this donor-related cost. My third topic on ethical challenges is related to monetary support for funeral for deceased donors. In 2016, the DICG group published a statement regarding payments to the family of the deceased donor. According to this statement, paying sums for funeral costs to the deceased donor family is outside the circle of ethical practice and fall into the category of organ commercialism because it is an incentive to promote organ donation. However, looking at this situation from an Asian point of view, offering funeral condolence money can be accepted because, firstly, it is a way of rewarding a heroic act. And secondly, the monetary gift is one of the most popular forms of gift in Asia. There is a YouTube video of British parents when they received cash as a Thanksgiving gift from their son. They were very surprised to receive this gift and said, "So they give money, but it's very countercultural for us." However, they, especially the mother, really like the monetary type of gift very much. And the third one is the concept of mutual help. Korean funerals are often lavish 3-day affairs with hundreds of guests, which cost a lot. It is expected that everyone joining to the funeral should make a monetary condolence contribution. And it is quite common to see Korean families are counting the condolence money at the funeral hall. Of course, it looks very strange to our international friends. And my last topic of ethical challenges in organ transplantation in LMICs is social and cultural pressure on female in living organ donation. According to the virtual seminar on gender disparity in access to transplantation in Asia of last year, and the follow-up data collected afterwards showed that more female living donors than male donors in LDKT, and even more female spouse donors than male in LDKT, as you can see in this updated summary screen from the abstract homepage. However, fewer women received KT than men in most Asian countries, even though the prevalence of advanced CKD was higher in women than men in most of Asian countries. There are both biological and social reasons listed here, and these findings are not specific to Asian countries. However, the consensus among the Asian participants was that social factors are the key contributors except for hypersensitization in women. And the main cause of the gender disparity in Asia was related to the gender pay gap rooted in social attitude toward women, providing less educational opportunity. In summary, ethical principles in organ transplantations are based on four main ethical principles. Self-sufficiency is the essential condition for ethical organ transplantation. Resource-contained countries are facing difficulties because of insufficient financial and human resources for system development. This situation causes organ shortage and subsequent ethical challenges. Among those challenges, we have discussed topics related to organ trafficking, keeping financial neutrality in organ donation, monetary support for deceased donor funeral, and gender disparity in resource-containing countries. I'd like to close my talk by thanking the organizers for this opportunity. And I'd like to thank our team members, co-workers, and advisors for their hard work. And all of you are here today. Thank you very much. Thank you.